My name is Megan, and I'm currently a nursing student at the University of Michigan. My clinical placement this semester was at Heartland Healthcare Center in Ann Arbor, Michigan. Today, I will be presenting to you a patient. My patient is a 64-year-old Caucasian male. He is currently single and has never been married. His usual occupation is at Cambridge Digital. He is currently unemployed. Patient's vital signs were all stable. Blood pressure was 144/71, pulse was 59 beats per minute, respirations were 18 breaths per minute, and temperature was 96.7 degrees Fahrenheit. The patient's chief complaint is of an ischemic stroke of the left carina radiata, for which he was admitted to the University of Michigan Hospital in November 2013. He was then admitted to Heartland on November 14, 2013, where he has remained ever since. The stroke left him with limited use of his right side. The patient has impaired mobility, mental status change, and is limited in his activities of daily living. Past medical history. The patient is a paraplegic due to a C7 spinal cord injury when he was 17. After having surgery, he remained in the hospital for several months. He now uses an electric wheelchair as his means of mobility. Patient also has hypertension, a systolic murmur, depression, and an overactive bladder, which he has a Foley catheter for. At this time, patient says that his recovery process has been slow and he does not believe he will ever fully regain his independence back. Patient is up to date on all of his immunizations. Patient does not have any drug allergies, however, is allergic to lactose. Patient is currently taking numerous medications for muscle spasms, overactive bladder, hypertension, high cholesterol, infection prevention, and laxatives. Functional assessment. Patient occasionally smokes. He does not use any recreational drugs or alcohol. He does not drink caffeine. He is not able to exercise regularly. Patient describes his sleeping patterns as not bad and reports that he naps regularly. Psychosocial data. Patient is a very pleasant and talkative man, although he has been diagnosed with depression. He has 3 sisters and several nieces and nephews. However, they all live in various states in the U.S. and outside of the country. He still remains close in touch with them and reports that they are all still very loving and supportive towards him. Patient relates most closely to the Western culture and does not identify with any type of religion or religious beliefs. Patient received his associate's degree. Patient did report having a stressful life, mostly due to his spinal cord injury. However, he states that his parents were very supportive of him. Family history. Father also had a stroke. Neurological. Due to his recent stroke and change in mental status, a neurological exam on patient would be imperative. Patient denies any feelings of tingling, numbness, or burning above the waist. Patient denies any seizures. Patient experienced loss of consciousness at the scene of spinal cord injury. Patient denies having insomnia. Patient denies anxiety interfering with his activities of daily living. Patient experienced difficulties with speech directly after his stroke, however no longer experiences it. Upon examination, patient appeared to be his stated age. His vocabulary and speech was appropriate for this stated age. He appeared to be alert. Patient was alert and oriented to person, place, and time. Patient was able to name 3 objects. Patient was able to name a pencil and a watch. Patient was able to obey a 3-step command. Patient was able to read a sentence and do as it said. Negative findings. Patient was not able to spell the word world backwards. Patient was only able to recall one of the objects listed at the beginning of the exam. Patient was unable to write a sentence or copy a design due to limited use of right side. Patient scored a 20 out of 30 on the mini mental exam. Patient was able to discriminate light and painful touch on his upper extremities, but has no sensation in his lower extremities. Patient was able to touch his fingers to his nose and his nose to my finger. Patient was able to do rapid alternating hand movement, although it was slow. Patient was unable to do stereodiagnosis and graphesthesia tests. Patient was not able to do proprioceptive tests. There were no Babinski or clonus reflex detected. All cranial nerves were intact upon examination. Musculoskeletal. Due to the fact that the patient is a paraplegic, it is also important to do a musculoskeletal exam. Patient did not have any visible edema. Patient's extremities were not abnormally warm and were normal in color. His upper extremities were contracted. He does not have a history of arthritis. Patient did not complain of any joint pain. Upon examination, patient has full range of motion in all upper extremities except in his wrists and fingers. Patient's lower extremities were stiff due to the paraplegia. Patient was graded a 0 out of 5 in strength in his lower extremities. Patient has diminished strength in his upper right extremities and was graded a 3 out of 5. Patient was graded a 5 out of 5 for strength in the remaining areas. Pertinent system number 1. According to an article from Walden et al., a peripheral vascular exam is a primary exam that needs to be performed on paraplegic patients. According to Walden et al., spinal cord injuries resulting in upper or lower motor neuron lesions may modify vascular reactivity in denervated region. This exam is also important to pay close attention to any ulcers that may appear to the upper and lower extremities of the patient due to them being bed or chair bound. One finding from Walden et al. Concluded that many paraplegic patients present a uniform decrease of peripheral vascular amplitude throughout the lower extremities in the presence of normal distal arterial pressures. Pertinent system number 2. Because patient is and has been a smoker, it is also important to do a respiratory exam. According to an article from the University of Maryland Medical Center from 2013, cigarette smoking is the major cause of COPD, or chronic obstructive pulmonary disease. When doing a respiratory exam on the patient, there may be wheezing sounds, bronchi, or crackles present in the lung sounds. The lung sounds would also sound diminished and distant. The patient may also have difficulty inhaling and exhaling while taking deep breaths.